everyone. I am Snigdha Bharadwaj, Assistant Professor, IT's College of Pharmacy. I welcome you all in this session. This is going to be a last session of Unit 3rd in Biopharmaceutics and Pharmacokinetics. So, we will discuss about the remaining part of pharmacokinetic parameters. So, let us get started. So, basically in our earlier previous 3 sessions, we have been discussing about clearance and their models and their estimations. So, now we will be continuing with the same thing, and also we need to consider and know about the various factor affecting renal excretion and clearance. So, after studying identifying methods, we need to know what are the different factors which are affecting renal excretion and clearance. So, first is physicochemical properties of drug. So, I will one by one explain. Plasma concentration of drug, distribution and binding characteristics of drug, urine pH, blood flow to the kidney, biological factors, drug interactions, disease states. So, basically physicochemical property of drug includes like the nature, partition coefficient, physical nature of drug, chemical nature of drug, its like melting point, solubility, pK, absorption constant, and pH, partition coefficients, log P, HLB. So, all these parameters comes under physicochemical properties of drug, right. So, plasma concentration of drug, that means is this solubility or hydrophobicity basically represents its the crossing capacity and absorbing capacity of the drug to reach systemic circulation. So, if the drug it is basically related to that physicochemical properties. So, renal clearance may be affected by how much quantity of the drug present in the blood plasma will be subjected to eliminated only. Unabsorbed drug cannot be eliminated. Once it can reach to systemic circulation, it will be eliminated or it will start eliminating from the systems. Distribution and binding characteristics of drug. If the drug is the binding affinity is very high or it is binding for a long time. So, the elimination rate will be lesser or clearance will be very low. So, and urine pH, the pH is also important parameter here for the clearance. Blood flow to the kidney. Yes, the blood flow to the kidney also depends on the drug's clearance, because the drug in plasma is subjected, the blood flow matters, because how much blood is entering to a kidney and the drug content it is containing or drug amount or concentration, it will be subjected to eliminated. Biological factors, various biological conditions like disease states and body pH and flow of blood and fluid flow and fluid amount. So, all these biological factors play an important role. Drug interaction, is there any drug interaction which interferes with its elimination and clearance process, is also a factor affecting renal clearance. So, first we will discuss physicochemical properties of drug. Molecular size, basically drug with molecular weight less than 300 Daltons, water soluble, are excreted in kidney. So, these can be easily excreted if it is of if it is containing small molecular weights. So, molecular weights between 300 to 500 Daltons are excreted both through urine and bile. Drugs or metabolites more than 500 Daltons, mainly in bile, excreted in urine to a lesser extent. As the molecular weight increases, the drug will be excreted less in urine and more in bile. So, pK is an absorption coefficient and constant. So, excretion of unchanged drug is inversely related to its lipophilicity. Yes, excretion basically depends on its lipophilicity. If it is inversely related, basically excretion of unchanged drug is inversely, and this excretion inversely proportional to its lipophilicity. So, if drug is highly lipophilic, that means excretion, if it is high, it is low. So, inversely relationship they maintain, that if drug is highly lipophilic, that means the drug is lesser to be excreted from the system, and to show the good binding. Stereochemical nature of drug. So, it is also important. Stereo, what type of stereo or the configuration the drug structure may contain, which type of active form it is containing. So, it also affect the physicochemical properties and affect the overall clearance process. Physicochemical properties next, plasma concentration of the drug. So, you can see here in the from the graph renal clearance, rate of excretion and plasma drug concentration. So, first drug is drug excreted by filtration only, second drug filtered and actively reabsorbed, third drug filtered and as well as actively secreted. So, all the three processes comes together and it is represented in renal clearance and the rate of excretion. So, this is the first type you see here, it is showing linear graph in renal clearance, right, whereas renal clearance will be down for third type of drug, drug filtered as well as actively secreted, and second is going up, that is utilizing filtered and actively reabsorbed. Now, if you see that is a linear kinetics, it is following. Now, drug plasma drug concentration and rate of excretion. So, plasma drug concentration of drug and rate of excretion will be high for those following drug filtered as well as actively secreted, and drug excreted or filtration only, the excretion rate will be higher, and then the lowest excretion rate will be seen in drug filtered and reabsorbed again. So, this is how we can get the graph distribution and binding character of drug. So, drug with larger VD, that is apparent volume of distribution, are poorly excreted in urine. So, drug bound to plasma protein cannot be filtered through glomerulus. So, drug with larger VD poorly excreted in urine. Those drugs usually have larger volume of distribution, they are poorly excreted in urine. Drug bound to plasma protein cannot be filtered through glomerulus. That means, GFR process will not be occur for those who bound to plasma protein with good affinity. So, CLR will be urine drug concentration into urine flow rate and plasma drug concentration. Obviously, urine, the drug concentration in urine and flow rate of urine decide the clearance of the drug from the body or urine. So, divided by plasma drug concentration. So, it can be represented as Fu, fraction of drug in urine, Cu, the concentration of drug in urine, and C is the plasma concentration divided by plasma concentration, or we can say F, that is flow of urine. So, CLR is equal to Fu into urine flow rate. So, overall renal clearance is this your this CLR is equal to Fu into urine flow rate. So, this is how we can calculate the urine flow rate. Blood flow to kidney and biological factors, blood flow to kidney and biological factors. So, again here is the biological factors affecting renal clearance. So, blood flow to the kidneys, increased perfusion, increased contact of drug with the secretory sites and enhance their elimination. That means, increased perfusion, increased contact of drug. That means, if the blood flow is higher to the kidneys, so it will improves or increase the drug contact to the particular site or organ and with the secretory site, and there enhances elimination. That means, highly perfused organ, if the drug is highly perfused organ will increase the elimination process, right. So, if kidney the blood flow to the kidney is high, on higher side, the elimination will be higher of the drug. Biological factors involved: renal excretion is approximately 10% lower in females than in males. So, basically it is a biological differences that may be the reason for this variation. So, renal excretion is approximately 10% lower in females than in males. Renal function of newborns is 30 to 40% less in comparison to adults and attain maturity between the age 2.5 to 5 months of age. So, basically renal function of newborn is 30 to 40% less as compared to adults and attain maturity between age 2.5 to 5 months of age. Renal excretion is approximately 10% less in females than in males. So, this is the data of physiological variations. In old age, GFR is reduced. So, based on biological conditions, it is affecting the renal clearance of the drugs. Drug interaction, it is an important parameter to understand, because it usually affect the clearance of drug from the body very badly, like alteration in protein drug binding. So, gentamicin, several drug interactions have been reported here, which may hamper the drug clearance. So, gentamicin induced nephrotoxicity by furosemide. So, when two drugs which are incompatible or interacting with each other in negative sense, that may affect one may affect the other's clearance pattern. So, these are some examples: alteration in protein drug binding, gentamicin induced nephrotoxicity by furosemide. So, furosemide induces gentamicin, and they protein binding affinity, they have different and bind itself when given together, and other drug is will cause toxicity, hepatotoxicity, nephrotoxicity basically. Alteration of urine pH, acidification of urine with ammonium chloride, methionine or ascorbic acid enhances the excretion of basic drug. Understand? Acidification of urine with ammonium chloride, methionine or ascorbic acid enhances the excretion of basic drug. When the pH rises, becomes low, and it will reach to acidic value of the pH, that will increase and that will trigger the elimination process of the basic drug, the drug having basic pH. So, this is how it is affecting the renal clearance. If the acid pH, the pH will become in acid range, that it will be like the increase the value or renal clearance of basic drugs. Alkalinization of urine with citrates, tartrates promote excretion of and vice versa. So, for acidification, ammonium chloride, methionine and ascorbic acid compounds, basically these are some examples given here. They are responsible for increasing the excretion value of the basic drugs, whereas the substances like citrates, tartarates, they promote excretion of acidic drugs. Competition for active secretion. So, competition for active secretion, phenylbutazone competes with hydroxyhexamide for active secretion and then thus prolongs its action. So, when two drugs compete each other with for their active secretion, so basically based on this, the overall effect of any of drugs or both drugs may be enhanced and may be prolonged. So, forced diuresis, all diuretics increase elimination. So, all the diuretics which are given to a in particular therapy or to patients, they usually increases the elimination process of drugs. Disease state. So, disease state basically renal impairment, the patient those having impaired kidneys. So, renal dysfunction impairs the elimination of drugs. Causes of renal failure are hypertension, diabetes mellitus, hypovolemia, nephrotoxic agents like aminoglycosides, phenacetin. So, these are the drugs which are usually responsible and the conditions which are usually responsible for renal impairment. So, and next condition is uremia. It is also a renal impairment. Uremia is a condition characterized by impaired glomerular filtration and accumulation of fluids and protein metabolites. So, it is a condition in which the protein and fluids metabolites are accumulated and causes renal dysfunctioning. So, drug accumulation and toxicity may result. So, sometime if renal impairment is there and kidneys are not functioning properly, that may interfere with the drug clearance and may cause toxicity. Clearance, non-renal routes of drug administration, drug excretion. So, non-renal routes for drug excretion. So, basically we have discussed about kidney for majority clearances of drug, apart from that liver and in the form of bile and also other areas, other parts like lungs and all minor clearance, but the non clearance routes for drug excretion includes the drug and their metabolites may also be excreted by routes other than the renal route, called as the extrarenal and or non-renal route of drug excretion. So, drugs and their metabolites may also be excreted by other than renal route called as extrarenal or non-renal routes of drug excretion. It includes biliary excretion, pulmonary excretion, salivary excretion, mammary excretion, skin dermal excretion, gastrointestinal excretion, genital excretion. So, basically biliary excretion, pulmonary through lungs, salivary through saliva, mammary through mammary glands, skin through skin and dermal, gastrointestinal excretion through GIT and genital through genital organs. So, this is the non-renal excretion. So, biliary excretion, if we talk about the ability of liver to excrete the drug in the bile is expressed by biliary clearance apart from these renal clearances. So, biliary clearance rate divided by plasma concentration, biliary clearance rate divided by plasma concentration. So, clearance rate will depend on bile flow, biliary drug clearance and plasma drug concentration. So, likewise we can analyze if we want. So, we can analyze all these parameters to get the total clearance. The pulmonary excretion, it is a gaseous and volatile substances such as the general anesthetics like halothane are absorbed through the lungs by simple diffusion. So, some category of compounds are generally absorbed through lungs by simple diffusion. So, these are basically volatile category substances. So, pulmonary excretion will be done after for once they get absorbed. Salivary excretion, excretion of drugs in saliva is also passive diffusion process and therefore predictable on the basis of pH partition hypothesis. So, salivary pH partition hypothesis. So, basically drug excreted in saliva basically depend on its pH partition hypothesis coefficients. If the drug is having appropriate partition coefficients, so they can be excreted in the saliva. Mammary excretion. Excretion of a drug in milk is important since it can gain entry into breast feeding infants, right. So, during lactation it may be excreted, the drug which mother is taking up. So, it may be excreted in milk during lactation to the feeding infant. Excretion of drug in milk is a passive process and is dependent upon pH partition behavior, molecular weight, lipid solubility and degree of ionization. So, all these physicochemical properties of drug reflects its ability to be excreted through mammary glands or mammary excretion. So, all these pH partition behavior, molecular weight, lipid solubility and degree of ionization. So, skin and dermal excretion. Drug excreted through the skin via sweat also follow pH partition hypothesis. So, basically the drug clearance route other than renal depends on more on the physicochemical nature of the drug product to be getting excreted. Compounds such as benzoic acid, salicylic acid, alcohol, antipyrine and heavy metals like lead, mercury and arsenic are excreted in sweat. So, this is how the drugs specifically written here, few of them are have ability to be excreted through sweat as well. Gastrointestinal excretion. Excretion of drug into the GIT usually occur after parenteral administration when the concentration gradient for passive diffusion is favorable. So, basically the GIT excretion of drug into GIT usually occurs after parenteral administration, because in parenteral administration you are giving you are administering the dose of drug directly into systemic circulation, and when the concentration gradient for passive diffusion is favorable, then it will be secreted through GIT as well. The process is reverse of GI absorption of drug. This is the reversible process of GI, because in conventional oral administration you see that first it is going down to GIT and then getting absorbed through systemic circulation, and in this gastrointestinal excretion specifically drug is excreting to GIT from the blood circulation, that is it is a reverse process. Genital excretion. Reproductive tract and genital secretions may contain the excreted drugs. Some drugs have been detected in semen. So, sometimes it is the drug ongoing treatments can also be excreted through this reproductive tracts and genital secretions. Drug can also get excreted via the lacrimal fluid. So, this is the factor affecting clearances. So, once again we will have a quick look what we have covered. So, we have basically covered factor affecting renal excretion, in which we have discussed physicochemical property role of drug in clearance, which affects the clearance value, the plasma concentration of drug, distribution and binding characteristic of drug, urine pH, pH increases, if the pH if it is acidic, then it will increase the renal clearance for basic drugs, and vice versa. Blood flow, highly perfused organs or high blood flow may enhance the elimination rate of the drug. Biological factors, if any impairment and diseased condition is there, they inversely affect the elimination and clearance of the drug. Drug interaction also hampered the elimination and clearance of drug disease state as well. So, after this physicochemical we have discussed molecular, size and various parameters, and also this distribution and binding character of drug. Now, blood flow, biological factors, drug interactions. So, several drug interactions has been stated here. So, apart from this, these are few and many more you can find it. Disease state also, renal dysfunctions and uremia. After that, non-renal routes like biliary, pulmonary, salivary, mammary, skin, dermal, excretion, gastrointestinal, genital. So, we discussed it thoroughly. So, these are references. I hope now you are able to understand about the various pharmacokinetic parameters and their involvement in studying these pharmacokinetic assessments. Now, all these sessions are belong to basically from unit 3rd, and you can have a look on these particular sessions related to pharmacokinetics and their basic model, especially one compartment model and the various pharmacokinetic parameters and their importance and mathematical expressions. So, with this note I would like to conclude my session today, and I hope you find it useful. You please have a look on all the sessions of unit 3rd. Thank you, take care, stay safe.